Okay, good morning, good afternoon, good evening, nasaan man po kayo sa parte ng mundo. Maraming salamat po sa inyong pagtangkilik at pagsubaybay at pag-attend po ng ating Stop COVID Death webinar series. Today, we will be celebrating our 60th episode po. So umabot na po tayo sa edad po ng mga senior citizens, but we are really very happy that you are joining us today in our milestone as we continue on in our 5th season of our COVID-19 learning journey together. So as an offshoot po of webinar 51 entitled SOS, Save Our Systems from COVID-19 Surge, this webinar topic was suggested by one of our loyal viewers, Dr. Reynaldo E. Santos of the UP College of Medicine class of 1981. He identified the issue po with regards to the transmission of SARS-CoV-2 virus as one of the pressing issues related to the pandemic. So the Stop COVID Deaths webinar team po talaga is always receptive sa inyong mga suggestions, sa inyong mga ideas. So if you have any suggested topics, really something that you are hankering to be talked about, please keep on sending your letters to us, and we always discuss that in our weekly meetings po. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. It's always a pleasure to be with all of you during our regular Friday lunch date. And I always look forward to our Fridays because I get to share hosting duties with my partner in crime, my mentor, also our adjunct research faculty, National Telehealth Center, and really one of the renowned public health communicators that we have, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond. Good afternoon. Magandang araw po sa inyong lahat. Wherever you are, those of you who are watching, joining us on Zoom, and those of you who are on YouTube or Facebook, we welcome you to the webinar. You know, Raymond, sa tama yung sabi mo, yung mode of transmission, how do we actually get SARS-CoV-2 or how do we get an infection, is probably the most important piece of information that anyone can have. Because if you know how you get the virus, then you can prevent getting it. Instead of just trying to follow rules and then not understand why the rules are there in the first place. So we have a fascinating discussion today. Marami po tayong mga kasama, hindi po mga doktor, may kasama po tayong engineer, may kasama tayong physicist, at meron po tayong kasamang broadcast journalist. Kasi hindi po sapat na alam natin kung paano nakukuha yung SARS-CoV-2. Mas importante pa yung paano nating masasabi sa ibang tao yun, paano maiintindihan ng tao sa madaling paraan. So wag po kayo umalis, marami po tayong mga magandang pag-uusapan. We just want to welcome all the Metro Manila hospitals who are watching. They're always here. And again, I'm seeing more of our colleagues in the Department of Science and Technology at saka sa Department of Education na kasama natin ngayon. Welcome po sa inyong lahat. Raymond, over to you.
Thank you, Dr. Susie. So maraming salamat po sa ating mga taga-subaybay po ulit, no? But for those who are joining in for the very first time, i-relate lang po natin ang ating webinar structure. We start off with really the main presentation from our main discussant, followed by a series of reactions from our esteemed panel of guests. Then we move on to the Q&A section wherein we may be able to identify one or two of our live audience here dito po sa Zoom na magtanong po ng kanilang questions live to our resource persons. We are also being live stream po sa YouTube channel ng TVUP, also in the Facebook pages of the University of the Philippines, the TVUP page, and also the Stop COVID Deaths page. We also are very happy to let you know that all, lalo na po yung mga nagtatanong po paulit-ulit, lahat po ng ating mga previous episodes ay naka-archive po, naka-save po ito sa ating mga channel. So you could watch our previous 59 episodes at ito rin pong episode na ito pagkatapos ng ating webinar. But before we proceed, Dr. Susie has an announcement po, lalo na po sa ating mga viewers outside of the Zoom. Dr. Susie?
Okay. So thank you very much, Raymond. And my goodness, 60, oh my goodness, I didn't realize we've been doing this for 60 weeks. already. And well, we wouldn't be here kung hindi sa audience natin. No? So we just want to thank all of you. If it was not for you, for what we now call a community, no? Parang may grupo talaga tayo na we're always here. And just continue to put in the chat box your questions, your comments. Minsan may mga discussions sa chat box natin maganda. We've got a Q&A box. And of course, later we'll see if we have time to pick up a couple of questions from the audience. But right now, for our fun poll, we have our Mentimeter. And for those of you who are watching on Facebook or YouTube, you can still participate in our opinion poll by going to www.menti.com and use the code 2803-0627. So I'll say it again. You can see it there, 2803-0627. And we're also going to put that in the chat box. I think Raymond already did it. Okay, Raymond, over to you.
Thank you, Dr. Susie. So yan po, no? Sa mga nagtatanong din po, kung ano po nakikita nyo sa Mentimeter po natin, also that is what is being flashed sa ating mga Zoom attendees. So please don't fret and don't hesitate to join our fun polls po. No? And but before we proceed, let me take this opportunity to thank the very hardworking team behind the Stop COVID Deaths webinar series. Maraming salamat po sa bawat isa. Really, we try to strive each week to bring you quality and meaningful and informative webinars that everyone will be able to learn from. Also, for those who are asking, ito po ang itsura ng ating webinar certificate, at least for webinar number 60, TVUP. May we have that on the screen? Thank you so much. For those who have spent at least 50% of the webinar duration, you will be able to receive something similar to this one, an e-certificate, along with the copy or the link to the copy of presentations by our resource speakers. Okay, Dr. Susie.
Okay, thank you very much, Raymond. And to open our webinar today, we have, of course, somebody who is an expert in communication. We thought communication is really going to be a key discussion point for today. So we've got the Vice President for Public Affairs of the University of the Philippines and our producer for the Stop COVID Deaths webinar, Dr. Niña Pernia, Dr. Elena Pernia. Niña, welcome to the webinar.
Oh, thank you very much, Susie, and thank you, Doc Raymond. No, so, isang bati ng mabuhay sa lahat, lalong-lalo na sa ating mga webinar regulars. Maraming salamat at narito na naman kayo. And to those who are new to our Stop COVID Deaths community, naku, a warm welcome to you all. And wherever you are in the world, good afternoon, good evening, or baka good early morning sa inyo. Nasabi na kanina na 60 na tayo dito sa ating webinar. 60 years is a very significant age. It's an age to be proud of and to celebrate because a person who would have survived the slings and arrows of 60 years still has a lot of life left. The number 60 is important in the Eastern or Asian tradition. When you reach the age 60, you would have completed a full cycle of life. You have been around the Chinese zodiac with its 12 animals 5 times, one for each of the 5 elements: metal, fire, water, earth, and wood. For us Filipinos, there are benefits of being 60. We have the 20% senior citizen discount plus VAT exemptions. And this can be used for a lot of things, no? Food, medical supplies and services, domestic travel, leisure and recreational fees, and funeral and burial services. And on top of that, there are freebies like free medical and dental services in government agencies, free flu and pneumonia shots for those who are qualified. Hitting 60 doesn't make one necessarily old. 60 is senior but not quite elderly yet. Have you heard that 60 is the new 40? Our Stop COVID Deaths webinars hits 60 today. And like a person who has gained wisdom and experience at age 60, our Stop COVID Deaths webinar series has grown through the meticulous back-end planning and production work. All our episodes have responded to the need to discover, discuss, and disseminate the highest possible standards of care for COVID-19 patients. Throughout its 60 episodes, our webinar has shown how medical and research experts from the University of the Philippines and other agencies have united to bring innovative solutions to help ensure health and safety at this time of pandemic. And I believe we have done quite well in communicating these. For so many among the general public, not only in the Philippines, but also around the world, much of the COVID-19 response seems hopelessly impenetrable, mired in scientific terminology and impersonal statistics. Our weekly webinars, which are like fireside chats led by medical experts, have become invaluable sources of reassurance, as well as a reconnection with the human side of the pandemic response. Locally, our viewers are provided with the context of COVID-19 public health management, while audiences around the world are able to get information on the Philippine experience. It takes a village. We've heard this phrase often applied to raising children, but it is also suitable to the fight against COVID-19. The village approach emphasizes the importance of connection and community as key elements in the response to the pandemic. COVID-19 is frightening and isolating, and even a mild case can be unpleasant and scary. Moreover, the pandemic has had a profound effect on people's mental wellness. Who among us have not heard that one or more of our friends and acquaintances are dealing with depression, anxiety, stress, and frustration? For them and for us, there is an even greater need for connection, for fellowship, and for community. It takes a village to cope with the uncertainties brought by COVID-19. It takes a village to build resilience, which is why a multidisciplinary approach is important in the response to COVID-19. Many of our webinars exemplify this multidisciplinary and interprofessional approach. But today's episode, I believe, is among the most diverse that we've had. We will hear the perspectives of an engineer, a physicist, an infectious disease specialist, and a broadcast journalist. It is our hope that having such an interprofessional team, this episode can improve communication and education on COVID-19. Thank you, and over to you, Doc Raymond and Doc Susie.
Thank you very much. That's Dr. Elena Pernia, Vice President for Public Affairs with the University of the Philippines, and one of the moving forces behind Stop COVID Death. She's with us every week that we prepare. And so we're really getting great guidance from Neni and from her vast experience in the area of communication. So Neni, please join us later for the panel discussion. And right now, I think we are going to have our fun poll, Raymond.
Yes, that is correct, Dr. Susie. Thank you, VP Neni, for opening remarks for our 60th webinar po, no? TVUP, may we also have on the screen be flashed? There we go. Okay. So we have two questions. As always, I will read off the two questions po. Starting with question number 1, which is a situational question. You are planning your family Sunday lunch in a public place. Where do you think would be the safest setup? pagsapit po ng alas 12 ng tanghali? Is it an open air garden or garden setting or al fresco? Is it in a restaurant with open windows? Sa restaurant na may electric fan? Kawawa naman kung may restaurant na wala. An air-conditioned restaurant po. Dito po sa ating 4 choices. And then for our, please keep on inputting and keying in your answers. I am seeing a little less than 200 po, and we have a little over 1,100 attendees in our Zoom webinar at the very least. Very consistent. Ang pinipili po ng ating mga respondents is the open air / garden setting / al fresco dining. So please key in your answers. For our second question, may we have it be flashed on the screen? There we go. The following principles that should guide decisions around retrofitting spaces, whether it's a classroom, sa bahay, sa opisina, etc. Except, ano po ba rito ang hindi po dapat gagamiting guide para sa ating mga desisyon? We are seeing answers trickling in, and as the answers are trickling in po for both the first question and the second question, let's take this opportunity to greet our regular viewers or ang ating mga taga-subaybay all the way from Cabad District Hospital in Agoo, La Union, Subic Dispensary in SBMA in Olongapo, Romblon, State University in San Jose, Romblon, Mambusaw District Hospital, Mambusaw Capiz, and Dr. Arturo Pingoy Medical Center in Coronadal, South Cotabato. Internationally, we are continued to be watched po, no? Live and also in the playback, Nagasaki University, Nagasaki, Japan, from Bangkok, Thailand, Semarang, Indonesia, Riyadh, Saudi Arabia, Dubai, UAE. First time po itong next Tunbridge, Wales in England, Neptune, New Jersey, the University of Fiji in Nadi, Fiji, and our regular from Niagara Falls, Ontario, Canada. Kumusta po kayo? Nasaan man po kayo sa parte ng mundo? At maraming salamat po sa inyong pagtangkilik at panonood po ng ating Stop COVID webinar. For the second question, the options are as follows. If affordable, it will be distributed air filtration system. Second option, if there are windows in a non-air-conditioned room, pakibuksan po ito. Third option, if the room is enclosed, put in fresh air ducts. And the fourth option, if there are no other options, put ceiling fans. Yun po ang karamihan ng ating mga attendees, or at least the respondents, are gravitating to that last option. We will ask our experts later on towards the end or later on in our show which of these questions which of these options are the correct answers to the two questions. So over to you, Dr. Susie.
Thank you very much, Raymond. And we proceed now with our webinar. TVUP usually comes up with some videos that help us visualize and have a context about what our topic is. And I think today we really want everyone to think about what is a high-risk situation, what is a low-risk situation. And so we're going to see some scenarios from TVUP. Over to you, TVUP.
In the grocery, siksik sa pila, pero tama ang suot ng face mask at face shield. O may physical distancing, pero mali ang suot ng face mask at face shield. Paano ang paglagay ng electric fan? Nakatutok palabas o nakatutok paloob? Magbabarkada, kakain ng tanghalian sa mall, o kakain ng baon sa park. students in the classroom. Teacher opens the window, or teacher opens the aircon.
Okay, thank you very much. Thank you very much, TVUP, for that very graphic presentation of what we want to talk about today. I think we want to be able to give people good advice about what principles to follow when we're talking about high risk, low risk transmission. And, you know, the discussions around is this airborne or not has been going on from the very beginning. It's been going on from the very beginning. Actually, in hospitals, we do take airborne precautions because there are certain procedures that can push the virus into the air and make it easier to inhale. But what do we know now about SARS-CoV-2? In the beginning, we didn't know that much. What do we know now? Even if particles can be suspended in the air, are they viable? Can they actually reproduce if they're inhaled? There are a lot of considerations, a lot of questions about whether we are just dealing with aerosols that come from procedures in hospitals, or can you really have particles floating around in the same way that tuberculosis and measles are airborne? And if SARS-CoV-2 is indeed airborne, how long can it stay in the air? So lots of questions, and we said we are not going to have just doctors today. We have an engineer and a physicist and a broadcast journalist, but we will still have an infectious disease specialist who will help us interpret what all of this means. Okay, so we are privileged today to have the Associate Dean for Research of the College of Engineering of the University of the Philippines in Diliman, Professor Gerald Denoga, who's also known as Doc Happy. So Doc Happy, who's always smiling also, welcome to the webinar.
Thank you, and have a good day to everybody. So,
Okay. Yeah, go ahead, Doc Happy, with your presentation.
So kindly allow me to present some slides as opening to our discussion today. The topic is entitled Airborne or Aerosol, How is COVID-19 Transmitted? But take note that this is from an infection control perspective, from an engineering perspective. Now, if based on the World Health Organization, the virus is spread by infected secretions such as saliva and respiratory secretions, or the respiratory droplets, which are expelled when an infected person coughs, sneezes, talks, or sings. Infection may result if droplets reach the mouth, nose, or eyes of a susceptible person. And well, if you can see this infographic here, shown are the common transmission modes. So we have the droplets coming in from an infected person. Kung madapuan po yung mga kamay natin, and then ilalapat po natin sa mata or sa ilong or sa bibig natin, yun po ang tawag natin na direct contact. However, if those droplets ay babagsak po sa mga surfaces, they become contaminated, we call them fomites, and then we come in contact with those contaminated surfaces, we call that indirect contact. Pwede din po yung fecal oral na transmission mode, where from the bathroom, pwedeng ma-aerosolize po yung fecal droplets, and pwede po tayo mahawa from there. But our focus today is the droplets that are expelled into the air, and the issue supposedly is it going to be airborne. Now the irony there is the discussion on airborne versus aerosol, there is actually no significant distinction between the two. And in fact, all of these still actually come from droplets. Now, depending on our activity, for example, talking, coughing, sneezing, they all emit different sizes of droplets. Okay, and para sa atin po, meron po tayong sizes ng droplets. Merong maliliit, may malalaki, and shown po dito sa top left on the picture are yung relative sizes, kung ano yung micron size, and kung ano yung mga, on the figure on the right naman po, is ano yung mga klase ng mga, or sizes ng droplets na napoproduce ang katawan, okay, in such activities. And when you have, let's say, a cough or a sneeze, kadalasan, malalaki po yung droplets na gagawa niyan. And you will see later on na babagsak po siya kaagad sa ground. Okay. However, there are smaller particles, which we call aerosols, that they are a lot smaller. They are more mobile. Okay. That even minutes after they are expelled from the body, they will linger in the air. They will float, and depending on the air currents, they can travel farther and stay longer in the air and be active. As a demonstration po, this is a slide. This is a video clip from NHK World Japan, where we see the different sizes of droplets when a person sneezes. Okay, may malaki, yung very big white dots, but more importantly, meron tayong mga pinong-pinong droplets, okay, and they linger, okay. Tumatagal po sila sa air, and they are distributed, okay, in ways that you cannot see. Take note po na itong mga maliliit po na droplets, hindi natin ito nakikita. Siguro ang nakikita lang natin ay yung mga droplets na pag nag-hatching po tayo ay yung parang tulo ng mga laway natin. No, that's too big. Okay, those are very big droplets that can actually be, held back by our face shields or face masks. Now, this slide shows a simulation from scientists in Japan showing how big droplets will actually be spread, okay, over time. And sinasabi po dito that the bigger droplets, itong yellow, green, and blue droplets, will actually fall to the ground in about less than a minute. Okay, so okay po yan kasi dito po nanggagaling yung initial studies dati about social distancing na 2 meters, 1 to 2 meters, okay na po tayo. Okay. However, if we look at other activities, ito po ang isang recording na naman of usual talking lang. Okay. Kita-kita po natin na may mga droplets na kumakalat, naglilinger in the air. Let me play that again. And they don't drop to the ground. They're just there. Now, another slide, okay, and from another source from the Washington Post, they had their own experiments as well. Ito, nakikita natin na yung exhalation po natin will produce microdroplets as well. Now, of course, some people would argue, well, we already have health protocols in place. For example, face masks. Pag face masks, napipigilan supposedly yung pagkalat. Okay, and that's true. Okay, we can expect that at least half of the droplets that we expel can be impeded by face masks, as shown here. Even when a person sneezes, filtered out po yan. But there will be unideal cases. For example, if a face mask is not properly fitted or worn, this person here is on the cell phone, ill-fitted po yung face mask niya, and you could see the plumes of micro droplets going above, on top and on the sides. So we should be aware that hindi po perfect yung yung certain measures like face masks natin, there are still certain risks, okay, from aerosol distribution. So this is a simulation po on what happens when when aerosols are transmitted into the air. Now take note, aerosols ito in comparison to the bigger droplets kanina ng mga Chiong. Ito mas maliliit. Okay? Ito mga red ngayon mas pino, and they don't drop to the ground. Instead, they linger, and in this video, the simulation shows that even up to 20 minutes ay nandun pa din. Okay? So this can travel meters away, way beyond the 2-meter protocols natin. In fact, previous studies have shown that in just still air alone, pwedeng up to 8 meters. But I would actually beg to differ that if meron talaga tayong air currents, okay, may airflow po tayo, pwede siyang kumalat all across the room. Okay, so this is where the transmission controversy lies. There are droplets, and then aerosols are smaller droplets, and the different studies, not everybody agrees on how and how much aerosols are actually produced. That's one. The other one is, when we do expel a droplet, how many virus particles are in there? How many droplets are necessary to cause the infection? Now take note that I'm not a medical doctor, so I'm actually opening this discussion to our colleagues in the medical profession. But we have to agree that there is still certain ambiguity. Okay? Like, how long do aerosols remain infectious when suspended in the air? I have read papers where the half-life of the virus is an hour, but another study said that it can be all the way up to 8 hours in the laboratory. Okay, that's a huge discrepancy. And one of the biggest controversies is which transmission route, be it direct contact, indirect, droplet, or aerosol, is the most significant in a given situation. Now, even with the lack of agreement of the specific numbers, we have to, well, in general, I find that we all agree that the more time spent indoors with an infected person, the greater is the likelihood of transmission. And the thing to take away from here is that we don't really always know if the person we are with is infected or not. There are asymptomatic cases. We have seen cases where they may have been vaccinated, but then they still get sick and are asymptomatic. Or if we're in a hospital situation, we are tending to patients, there is still a likelihood of transmission. Okay? And from my perspective, even if it is still not proven how great a degree the transmission through aerosol is, we cannot ignore it, and instead we should just prepare for it. So these are the measures that we've done for infection control. On a personal level, we have personal protective equipment. So starting from the left, we start with face masks, and then we have face shields to supposedly cover our eyes as well. And then our medical professionals, I've seen them with half-mask respirators for better filtration beyond the N95 and the surgical masks. And then we also see people donning full, what we call powered air purifying respirators with the full protection. But these are on a personal level. Okay? But from a matter of information to everybody, we still have to do administrative controls. In this picture here, where we instruct people what to do. Tamang distansya, wear your masks. Okay? And the first two steps here will still require the cooperation of individuals. Now, if you're talking to, let's say, building administrators, unit heads, legislators, we should focus as well on the last two portions, which is engineering controls, where we have the opportunity and the resources and the means to set up the infrastructure, the structured environment to separate people from the pathogen and hopefully eliminate the pathogen entirely. Okay. So just as highlight here, for example, is a very very crowded office space. There are barriers here, but from an engineering perspective, I see that there are huge flaws here with respect to the ventilation, the air distribution, and what I see here, it might actually not actually be helpful at all in controlling the infection. So we have strategies, and these strategies have to be applied to different situations. We have our homes, dormitories, offices, church, markets, hospitals, public places, public transportation, and iba-iba po yung cases nila. Some are open air. Some are indoors that are naturally ventilated by windows. Some po, meron tayong mga ventilador, electric fans. And then meron naman tayong mga air-conditioned offices and rooms. And depende po sa case na yon, we will apply the general strategies slightly differently. But in general, they have the following three main brackets. We have ventilation and air distribution. We have filtration, and then disinfection and sterilization. For all these strategies to be implemented, we, of course, require certain equipment or interventions. Like for disinfection and sterilization, we are familiar with the concept of wiping down things with alcohol or disinfectant and sometimes fogging. And these generally address what we call indirect transmission. When people were in the room, they might have expelled particles. We can sanitize those areas by wiping them down. Okay. Unfortunately, this is not a continuous process. Kailangan gawin ito pag nakaalis na yung mga tao. Now, there's another way to sterilize, becoming more prevalent, for example, the ultraviolet germicidal radiation. Shown here are photos of UV radiation. This is in LRT, where the UP College of Engineering actually partnered with them to provide disinfection protocols and devices. And these help primarily, again, against indirect transmission. Now, I've also seen some devices where yung UV po ay naka-install, let's say, in the air conditioning. And they also, therefore, try to cut down on airborne transmission by killing the viruses in the air. Okay. Now, there are different devices available in the market, and they have to be carefully selected. Kasi kung ultraviolet, there are specific doses lang that will actually kill the virus, and even specific types. There's UVA, UVB, UVC, and the most effective and most practical is UVC. Okay, but you also have to take note that there are certain durations, okay, on how much radiation and how long you expose a surface to for it to be properly sanitized. And that's just for the virus. There is some risk to the person. For example, UV tends to produce ozone, which is bad to the health. And if the light actually hits the person, okay, there is a risk to that particular exposure. So I will ask our medical practitioners to focus on that maybe later on today. Now, for real-time interventions, we are more familiar possibly with filtration. So just like our masks po natin are filters. But for the structured environment, we can put in something like air purifiers, where they actually have what we call filters that grab the particles from the air so that they will no longer float around and infect us. And please be aware that not all filters are actually appropriate for the COVID situation. We see ads about HEPA filters and all that, even the N95, but what do we really need? The World Health Organization and the CDC recommend a rating of at least MERV 13 or better. That means that it's at least 95% uh, effective in capturing particles. But please be aware na ang rating po dapat yan ay based on the 0.3 micron level. Okay, now microns, yun yung laki po ng kaya niyang saluin. Okay. There are some HEPA filters out there claiming to be HEPA filters, but they're actually rated 95% or better, but mostly for dust particles were actually just a lot bigger. Okay, so hindi sila suitable. So what I would recommend is something even higher than the World Health Organization na standard, which is a HEPA filter. Yung totoong HEPA filter, I would suggest an H13 na rating, which is a 99.95% na rating. Okay, so shown here is actually such an example of a filter that is installed on the ceiling of an office that allows the filtration of the air even while it is being air conditioned. Okay, and I like to highlight this particular product is because it is a lot bigger and more powerful than other kinds of air purifiers, so that it was properly sized. Okay, it is to match the room, so there's proper selection and it is properly installed, so that when you use it, it becomes both effective and economical. Okay, kasi we have to be practical about this. Okay? No point in buying anything if it's not both. Okay. Now, moving forward, the biggest strategy actually is ventilation. Now, by definition, ventilation has three parts here. We try to replace the dirty air in the room by what we call bringing in of outdoor, which in general we perceive as fresher, cleaner air. And to do that, we can simply open windows and doors. Because new or fresh air is coming in, we remove the virus-laden air. Fresh air in and contaminated air out. Of course, this implies na meron po tayong in and out niyan. So meron tayong isang, let's say, bintana na pagpapasukan ng fresh air and maybe another door to let out the contaminated air. And if it's in a large room, it helps if there are fans and ducts to assist the flow of air. Where by doing the replacement of room air and removing the virus-laden air, ang end goal po natin is to lower the overall concentration of virus-containing particles in the air. We want to remove the ones that are recirculating or floating around. So I'll show you just a video here, okay, where these are particles floating around. Okay, but by the simple act of opening a window, in as little as a minute, evacuated na po lahat. Okay, ganun lang po kasimple. And there are, for large rooms, we can suggest, for example, fans, blowers, or filters, and we recommend a particular number, which we call the number of air changes per hour. And the CDC and ASHRAE, yung Engineering Association for air conditioning controls, recommends at least 6 to 15 air changes per hour to replace 99% of air in about an hour. Okay, so yung 6 is a general number po, but I have seen where for clean rooms, for hospitals, where it can go all the way up to 15. So wag lang po sana tayo bababa ng 6. Now you might think, gaano ba kahirap yung 6 changes per hour? In fact, it isn't it. Tipong, I will show examples later where a simple electric fan in a properly placed location can actually suffice. Now, let's start with what many of us are exposed to. For example, our offices and our, let's say maybe hospitals where the first scenario on the left, we have an air conditioner. Most air conditioners in the Philippines are split types. So hindi actually siya connected outside to suck in fresh air. So pag sarado po yung windows and doors natin, nag-recirculate lang po yung infected air. Okay? Ang default assumption kasi natin dito is there is somebody possibly sick or carrying the virus in the room. And we do not know. Okay? So we try as much as possible to avoid that recirculation. So we try to put in fresh air. So scenario number 2 is we open windows and doors, okay, so that what we call dilution of the air inside using clean air from the outside. And a natural airflow will come from the air outside the window at lalabas po sa doors natin. It will help, of course, kung meron po tayong exhaust fans. Now, in our offices, definitely there are bathrooms nearby, and almost always there are exhaust fans there. They will help. Okay, so there are simple measures to address or to minimize infections via airborne transmission. Now, the important keyword there is minimization, because we can only go so far in reducing the risk. Now, for a non-air conditioned environment, we have here let's say the household. Okay, so we can leave the doors and windows open, kahit partially lang po, and they will let air in, and naturally there will be currents, air currents. Na importante po dyan ay meron sanang in and out. Okay, it would also be better kung meron po tayong exhaust fans to help evacuate the contaminated air. And if meron po tayong extra fans to improve the circulation of air from the outside and avoid pockets of stagnant air forming indoors. Now, medyo maraming gray areas po pagdating sa fans, kasi ang typical practice po natin is pag mainit, itapat natin yung electric fan sa atin. So we cannot be sure if the air that is reaching our faces is coming from an infected person. Okay, so there is some compromise possibly in what the comfort that we are used to. Okay, however, there are slight adjustments lang po. Now, we don't necessarily need large currents, and preferably the currents are going from what we call clean air ang papunta sa inyo lang. Okay. Kung meron po tayong ceiling fans, there are kindly check your models ng ceiling fan niyo. Kung pwede na imbes na pababa yung buga ng hangin, it actually sucks air upwards, so that if there are infected people down below the fan, it actually removes contaminated air from them and is sent out hopefully to the open windows and doors. Okay. Now take note na meron po tayong mga case-to-case basis dito, which we can try to address later on in our discussions. Now, the important thing with ventilation is not just bringing air in and evacuating it, because it will take some time to do that. With ventilation, the biggest portion there is the direction as well, especially in big rooms. We try to do what we call an air movement flowing from a clean to a less clean direction. An example po dyan, outdoor air is generally accepted to be cleaner compared to, let's say, air na dumaan na sa tapat ng isang office mate mo. Okay, because we wouldn't know who is infected or not. So in summer, we need to minimize the potential to create air patterns na will directly flow across one person onto another. And of course, that implies we try to avoid recirculation. So the photos here are actually different scenarios. The one on the top right is where, for example, two people are in a small room with a window and a door that is open. This is actually coming from a recent study by Professor Ken Fernandez and Dr. Maynard Barana from the Mechanical Engineering Department, where they actually evaluated the effects of the placement of a simple electric fan, kung nasa bintana ba or nasa pinto, kung pabuga ba or pahigop yung electric fan, and how much air does it actually bring into the room, and how much air is brought out. An important part of their study shows also about yung particles that are circulated in the air. Okay, so this picture was shown na there is a huge risk pa rin talaga if your people are laid out in a certain scenario where in the same direction of flow sila sa hangin. Okay, yung layout nila. Ganon din sa baba, okay? Yung sa bottom left na photo, you have a classroom. Naka-social distance po sila. Okay, but in the case where it's just one window that's open, sinabi ko nga kanina, magbukas tayo ng bintana, di ba? But if it's just one pero kulob naman pa rin, there's walang paglalabasan, if there's somebody in the room na may sakit, in this case, the one in the front of the classroom, his yung dark red na contaminated air will continue to recirculate, which is bad. Okay, kasi madadapuan yung mga kaklase niya. Now, the other study on the right, where this is for a restaurant, where you properly locate yung buga po ng aircon at saka yung higop ng aircon so that the pockets of air are isolated to those people lang at hindi kakalat sa kabilang tables. Ang magandang example nga, nabanggit kanina during our previous discussions, kagaya yung sa like yung sa mga Korean restaurants na meron tayong exhaust fan in the middle. That's actually a good example of, if you notice, medyo isolated actually siya ng airflow. Now, similar slide, but the one on the bottom left is actually something applicable to buses and public transportation, where the agreed strategy, actually recommendations for buses, is that you have the air from the air conditioner, yung malamig po na hangin, ay manggagaling sa taas. Pero rather than higupin siya in general sa likod, dapat maglagay sana ng mga exhaust vents sa paanan ng mga pasahero para isolated po yung hangin sa kanila lang at hindi mag-cross sa mga ibang pasahero. So direction of airflow is critical in these studies. Now, there are so many scenarios actually. Tipong we cannot spend the entire time to list out all of these scenarios and recommend. So merong mga common strategies. Take note that they are on a case-to-case basis. For example, for non-air-conditioned offices and workstations, I did mention that to open the door and window on opposite sides. If there are a lot of windows, it is recommended to try to relay out those workstations to be beside the windows para yung dadapo sa inyo na hangin ay malinis. If it's even possible to put, let's say, exhaust fans or ducts behind that person, so from the window to the person to the exhaust, maganda yun. Okay, so higop ka agad at hindi na pupunta sa ibang mga office mates niya. Now, this number 4 item here is a bit counterintuitive. We normally see barriers, yung mga acrylic barriers that impede yung droplets, yung big droplets natin. Let's say from direct contact, yung yung direct expulsion ng droplets into our faces. That's fine. However, please be aware that these barriers can actually impede airflow. So pwedeng magkakaroon ng increasing concentration of viruses in one particular area, stagnant po yung air, hindi gumagalaw. And those pockets should actually be evacuated. Dapat nahihigop palabas yun. So may give and take po, may pros and cons po with putting barriers. Now, of course, kung alam naman natin na meron tayong infected people, the common sense there is we should place them downstream of the airflow. Yung figures on the right, the middle right shows the same study. Okay, and gleaned are actually the numbers taken from such a study where what will happen if you put an electric fan in different places. And this is just a standard electric fan, and the air changes per hour. Sabi ko nga, 6 nga lang minimum natin, di ba? But their studies found that if properly located at either the door or the window, you can have as much as 59 air changes per hour. And depending on the location as well, pakontian naman yung gusto natin na natitirang recirculated particles in the air. So from my recommendation, for example, is to have the air diluted so that less particles are recirculated. But of course, it is really the best to have both what we call a push and pull scenario, meaning may papasok po na hangin and merong palabas na hangin. Now, if we have air-conditioned offices, there's always that argument na kung buksan po natin yung bintana at saka mga pinto, lalabas yung malamig na hangin, tataas yung kuryente natin. I have to admit that that is a small price to pay, kuryente natin, compared to the health of our employees. So it is still recommended na kahit buksan nilang kahit konti, okay, yung windows. Now, if in the case where you know na hindi talaga kaya, there are some offices there na naka-bolt down yung mga bintana, we try to consider filters, okay, just like the one here shown, na may preferably multiple ducted inlets where you could have hoses na in certain clusters. Similar to nga, yung example ko nga, yung dun sa mga Korean restaurants, yung samgyeopsal. Okay, tingnan nyo lang po yun. If it's possible, you can try to lay out your workstations in a single ring clustered around an exhaust or a filter. So kahit magkaharap man sila, kung meron mang droplets na ma-release yung tao, imbes na aabot doon sa kabilang employee, ay hihigupin na kaagad ng filter. But take note that kailangan malakas din yung filter natin. Hindi yung basta-basta lang ng mga maliliit na filters na nakikita natin na pang USB lang. Kasi they have to be properly sized. Because if the air around you is not entirely clean, it is still possible that these filters will actually produce air currents that will bring dirty air to you. Okay, so sizing of the filter is very critical. So, even the undersizing of a filter and bringing it close to you might actually produce bad effects. Okay, so again, sizing is important. Yung tinatawag po natin na air changes per hour. In terms of cost, these are the initial costs. So technically, wala naman dapat cost sa pagbukas ng bintana or mga pinto, or even opening vents. A slightly higher cost would be implementing or using fans to increase the effectiveness of the windows and reposition them to create directional airflow. There was one application before where there was one particular smoky room, and our colleagues were thinking, how do we actually quickly remove smoke from that room where kulub siya? It's like the room is inside a building where there's only one door. And ang recommendation namin was, well, sadyain nyo na merong papasok talaga na forced na hangin, and then meron isa pang fan that actually sucks air out. Okay? So fans are relatively inexpensive. Now, a medium cost is to add filtration systems. And in general, they can be used to actually supplement the capacities ng air conditioners natin that we normally kasi think that our air conditioners can provide the air flow that we need. To be honest, no. Okay, that's a huge misconception where most air conditioners do not let in fresh air. Even if they do, the fresh air that comes from those tiny holes in those air conditioners, like the window types, are not sufficient to produce the 6 air changes per hour. Adding a filter that is properly sized can actually improve that, improve or supplement so that masatisfy po yung 6 air changes natin per hour. The costlier one is adding UV. Okay. Now, these are, of course, the initial costs, but you might have to just balance these initial interventions for both the initial cost and the operating cost to provide the most economical and effective way of controlling the transmission of the virus. Marami po talagang mga measures dyan, and we would like to invite actually the participants to discuss with us, panelists, so that we can provide further insights. Okay, but at the very least, thank you very much and stay safe. Thank you, everybody.
Okay, thank you so much, Dr. Happy. Very, very informative. Marami na po tayong mga katanungan. Number 24 na po ang questions that we are seeing on the Q&A. And we hope to be able to address all of those questions. Actually, I have a personal question po that I will ask later on, Dr. Happy. But before that, we will go on to our set of reactions. The first reactor for our webinar, she is no stranger to this webinar because we've had her so many times here. You know her as the head of the PGH Hospital Infection Control Unit and really one of our top infectious disease experts, Dr. Niña Berba. Ma'am Niña, magandang hapon po. And will you be the one to share your screen, ma'am?
Sige pa, okay.
Okay, ma'am.
Hello, Raymond. Hello,
Hello
everybody. Hello, Ma'am Susie. So, I'm just a reactor today. So, medyo konti lang slides ko and I'll just emphasize some of the points that was discussed by Professor Happy. No? So, wag na tayo malito sa terms. No? So, just to clarify, many of the infections actually are transmitted by droplets. So, pag umuubo kami, large droplets kasi these are laden within saliva. So they're called large droplets and they fall to the ground because of gravity. Pero habang in time...
Ma'am Niña, sorry to interrupt. Can you go to presentation view, ma'am, para lang mas malaki po?
Oh, okay. Sorry. Yeah. Sorry. Wait lang. Yan. Okay, yeah.
Okay.
So, large droplets would fall down to the ground because of gravity. Tapos, pwedeng magstay yung small droplets in the air. And that's the term called aerosol. No? So, pagka naubos na, nag-evaporate yung most of the saliva and other things in that droplets, they remain suspended in the air. Okay? So, that's what we call the aerosols. Now, yung term na airborne, that's part of the modes of transmission. So, sa linggo ng mga infectious people, infectious disease people, and in our health settings, merong 3 major modes of transmission. They're airborne, droplet, and contact. And I listed here the common illnesses that are usually associated with these types of transmission. So yung aerosols, because they're very small and they remain suspended in the air, pwede mo sila malanghap. Yun yung process of airborne transmission. And the triangle I put on the other side of this PowerPoint slide is that for SARS-CoV-2, even though there's this announcement na airborne na siya, we think that most of the infections still happen because of these larger droplets. No? So kung titingnan mo yung proportion of all infections, mostly happening still are because of the large droplets. Some infections may have happened because of airborne transmission, and very, very small yung contribution of the contact or the fomites. No? So parang ganyan yan. I may have shown this to you before. So pagka may infected person, meron siyang mga malalaking droplets talaga that are released into the space around him. And if people are around that infected person and tapos wala siyang mga PPE, personal protective equipment, pwede sila mahawa. But then again, if these large droplets transform themselves into aerosols, kahit na malayo, pwede ma-infect. But still, the understanding and observations of many different studies show that droplet transmission is still the most important mechanism of spread. So ganito rin yan. Yung parang pinakita ni Professor Happy, depending on what you do, whether you're just exhaling or coughing, wherein you produce this very more vigorous turbulent gas clouds that may travel farther out. No? And that affects the chances that other people can get infected. Tapos yung maliit na contribution ng fomites may still be important for some settings, no? Kasi kung heavy talaga yung viral load ng persons who are present in that small space. So, kunyari, maliit yung bahay, maraming tao, hindi masyadong naglilinis. So, this mode of transmission might also be important, especially since there are findings that some of the viruses can stay in the inanimate surfaces even for long periods of time kung hindi maglilinis, hindi magdi-disinfect. So anyway, parang many people really feel that the WHO announcement came very, very late. Already, parang they recognize the importance of aerosol or airborne transmission December na of last year. So parang 1 year na tayo into the pandemic, and that's the only time they recognize that this is an important phenomenon. So should we be worried about this late announcement? Well, the good news to everybody is we know that what we've been doing all this time really works. So physical distancing works, the mask, hindi tayo lahat kailangan mag-N95 all the time. Maybe if we're working in ICUs na may COVID or even in the COVID wards, we need to wear those kinds of masks. But in the community, as long as we're wearing the well-fitted masks, that should work. Adequate ventilation and avoidance of crowded indoor spaces. So, dagdagan ko lang yung sa mask being the most important aspect of all these precautions. Pwede ba mag-cloth mask? Pwede pa rin as long as there's been data for a while that dapat the cloth masks must have at least 2 layers of different kinds of clothing textile. Tapos ito, secret to yung ear savers. There's this really very innovative ear saver devices that you can purchase from Lazada, Shopee for very small amounts. What they do is they make sure that your masks really have a snug fit. Dapat hindi siya loose. Di ba kanina may pinakita si Professor Happy na parang kahit na may konting face mask, parang meron pa rin nag-escape na pwedeng clouds of this aerosol. So this will protect us. It must really be a snug fit around your nose and your mouth. Tapos, for the rest of the slides, I just want to show how we in PGH translated all these principles to our health settings, no? So, bakit kami hindi masyadong na-disturb sa hospitals when we heard that announcement of the WHO? Kasi all this time, we've been wearing the right PPEs, no? Meron tayong mga level 1, 2, 3, 4. Tapos nung nagiging parang we needed an extra level of protection, we shifted na nga to a level 2.5 that included wearing of KN95 mask on top as an option other than the usual surgical face mask. So kung ano man yung ginagawa nyo sa mga health settings nyo, be reassured that these are okay. Okay? And then in PGH, yung to address nga yung issues about ventilation, what we did was this unidirectional natural airflow system. We actually directed the movement of the air. So ito yung mga original drawings. Iniisip ko nga someday magiging mahalaga itong mga pwedeng i-archive na initial engineering drawings of how we designed the COVID ward. So we had these very, very large fans that provided the fresh air that Professor Happy was saying kanina. Kailangan may source ka of fresh air, and then the exhaust fans were parang ganito yan eh. We directed the flow of air so everything went into the garden na nandun sa loob within the pavilion. So it wouldn't get scattered, these infectious droplets theoretically won't get scattered into the traffic flow outside sa mga where the people were passing through. So that was how we did that. Tapos medyo crude to, pero how did we know that we were directing the papel dyan? Tapos, believe it or not, nakakita rin kami ng TB habang may COVID yung ibang patients. So within the COVID wards, we had to put in some additional infrastructure changes to again isolate the TB patients, the COVID patients with TB away from the other patients who may just have COVID. Naging very complex, but you have to just adjust to what you're seeing in the
excuse
world.
me.
Yeah.
During your video, we couldn't hear you or the video. Just the slide right before this. Would you like to go back to that? The one with the fan, with the electric. We couldn't hear you.
Okay.
Okay, let's do it again.
Sige. Pero nakita nyo to, diba? I was just showing here, so I'll So sana nakita nyo na merong mga papel sa taas ng mga doorway, and they were supposed to tell us how we were trying to direct the air kasi from the source, we wanted them to flow in the fresh, clean air, flow into the wards, and then pass through all the COVID patients, and then go inside this garden pavilion that's sort of enclosed, pero enclosed siya within the UP community, pero open pa rin yan. So it does not go to where the pedestrians were passing. Yun. So nakikita na natin to na it's very possible that patients can really have different or simultaneous infections, and you have to protect others. Iniisip namin nung umpisa, may COVID na sila. Kailangan pa ba tayo mag-isolate ng TB? But we didn't want to have the non-TB patients na may COVID to have TB while they're with us. So we had to put in new structures for TB isolation. Ito naman, we had many activities through the months of the pandemic that required us to just opt to do it outdoor. So whenever possible, and it involves a lot of people in whatever settings you're working in, try to do them in outdoor settings. So ganyan, kahit na maraming tao all at the same time. So that was the first surveillance for COVID we did, and this one was the vaccine rollout. We try to always do them in outdoor setting in the PGH atrium. Fortunately, we have this really big space that allowed us to do all of these big activities safely. What about kung may mga spaces, kung merong mga spaces, try to get fresh air to come in panay. So yun yung sinabi ni Professor Happy kanina, open the doors, no? So kunyari kayo, you have the option of if you want to go to churches and you're trying to decide what church you're gonna go to, one of the good places is the PGH Chapel. Talagang dinesign nila to well. They open the doors, they let the air in, and on top of that, there's the big ceiling fans on the main part of the chapel, and the in the back part where many persons may be there, there's additional fans. So we've been using a lot of ceiling fans also to push up the air, diba? And then we converted many spaces to outdoor spaces. So waiting areas of patients, for example, as long as you just provide enough seats that are far apart also. Tapos ito, for meals, we started having outdoor options also. So PGH to, parang ang ganda, Susie, no? Parang magandang alfresco. Pero ito naman, nasa parking lot lang to. So if you want to eat outside naman, merong options. Just that you provide options for people, safer options. Tapos kung gusto mo pa rin kumain inside PGH, so instead of eating in the cafeteria, we started like really putting markers and setting seats, chairs apart para people won't have to think. They just have to go in and sit down and stay safe even while they're having their meals. Tapos nagka-option rin to have the meals outside, pero ganun pa rin, merong physical distancing. And then what to do with closed spaces? Kasi syempre dami naming offices, daming lounges, call rooms. So that's where this additional equipment came in. We really tried to flood our offices with air purifiers and HEPA filters. Yan. And also make some changes in the arrangements of furnitures, no, so that we're able to maintain the physical distancing between people, even if they're in these closed spaces. So kasi syempre we have trainees who have to stay in these kinds of settings, closed settings for long periods of time. We need to manage all of those closed spaces and make sure our trainees are safe. So I guess in summary, always keep in mind that we should, as if we're administrators, managers, we need to give options to all our staff to be safer. Kung ikaw naman yung user, ikaw ay employee, staff member, personnel in an organization, then always keep in mind that you opt for safer options. So the safest are open spaces, and then the next level of safety will be places that you can open, like doors and windows. And maybe the last option would be closed spaces, but they can be improved if we put in some additional equipment. Yon. So as Professor Happy said earlier, this is the hierarchy of controls we follow in the health settings, but certainly ang kaya more effective yung nasa taas kasi people don't have to think every time they have to do some activity or procedure or task. parang engineering controls should make it safe for everybody, as well as administrative controls. So that's what we mean by systems approach, diba? When we think about making things safer, moving into the new normal, we have to think about making workplaces, transportation systems, community services, public places, all just parang naturally designed to be safer. So yon. So ito naman yung parang aming what we plan to coming up soon, but I've been saying this for several months now, yung coming up soon. But I think it's really coming up soon, very soon, in the next 1 or 2 months. We've designed the state-of-the-art isolation facility that puts together all the principles that about safer options in this particular facility. So watch out. It's something that we're really looking forward to. I-move namin lahat ng COVID patients inside the main building of the PGH into this facility. So yan, I put in here our local sa PGH 3238. Baka hindi namin masagot lahat ng mga tanong nyo, but you can always call us anytime. This is our team at the Hospital Infection Control Unit. If there's anything we can help you with, let us know. Thank you very much. That's it na.
Okay, thank you very much. That's Dr. Nina Berba, head of the PGH Infection Control Unit, and I think gave all of you a lot of good ideas about how you can improve infection control in your own hospitals, district hospitals, health centers, and so on. And we'll have a little bit more time to chat during the panel discussion, but I think it's great that she gave her number. Let's get the Nina, the trunk line as well, no? And we'll put that in the chat. Okay, my privilege to introduce our next speaker. So we promised we have a physicist, and our physicist is known actually as the former president of Ateneo de Manila University, Father Jose Ramon Villarin, Father Jett Villarin Jr., who actually works in the field of advanced physics and has been doing work on carbon dioxide and aerodynamics. So let me welcome Father Jett to our conversation. Father Jett, welcome, and please take the floor.
Thank you, Dr. Susie. First of all, I just wanted to tell you that I've not really been practicing in this field, although I used to do a lot of atmospheric monitoring, especially air quality. I've done a lot of monitoring of fine particulate matter before they conscripted me to administration. So I am what is known as an airhead. So I study the atmosphere. I also study the climate. Anyway, so first of all, let me just confirm what Doc Happy just said or recommended. No? Ventilation, diba, is very important. And of course, filtration and disinfection. But that said, and with Dr. Berba's also Nina's presentation, let me just try to familiarize yourselves with first, what's an aerosol? Because even the title itself can be misleading, yung title ng webinar natin. We said airborne or aerosol. I think, aerosols are airborne. I think the debate has been in the past, recent past, airborne or droplet. Droplet meaning particles that drop to the ground, that don't stay suspended for a long time. Aerosols, on the other hand, are fine particles that stay aloft. Ewan ko if you're old enough to remember, alam niyo ba yung bomba, yung insecticide, no? Yung, wala na yata ngayon pero kasi aerosol cans na ngayon. But when we were small, diba, you kung gusto niyo ibomba yung kwarto ninyo, ilalagay niyo ng insecticide, yung isang lata.
Baygon, Father.
Sorry?
Yung baygon, Father.
Yes, yes. Nabutan mo yun, Raymond. Ah. Okay. Then you start to pump it, no? And then you will see this spray, this mist. Di ba? And some of them will drop to the ground. Pero you know that some stay kasi naamoy mo eh. Even long after, di ba? Long after that they've been emitted. So these are aerosols. No, clouds are aerosols. You see clouds, or if you've been to Baguio, have you been in a cloud? When you go into a cloud, you don't see cotton. You see this fine, parang fog or mist. If you see it, it's big, still big, no? But they float. If you are in a bathroom, for example, and you turn on the heat, diba, after a while, you will see these little droplets. Pag nagkukulo kayo ng tubig, limbawa, you will see this smoke. Pero hindi po yun hindi po yun gas. Sometimes it's water vapor, but they're actually water droplets. It's very hard to form a water droplet. It's not easy. And to form one, actually, you need particles, fine particles. They call them nuclei. Kaya nga po, kung sa dagat, kaunti lang po yung ulap. Pero over land, mas maraming ulap. Kasi nga, mas maraming aerosol, mas maraming pollution, kumbaga. No? I used to measure PM 2.5 and PM10, EDSA, along EDSA and farther from EDSA. And this is what we could not understand. How come in air quality, the engineers and the scientists were saying, yeah, the pollution travels remotely, long distances. But why is it so different when it comes to COVID? If COVID indeed is carried by these aerosols, di ba? So anyway, I think the key here was yung micron, yung size ng particle. A micron is like 1/1000th of a millimeter. So hindi mo makikita yon. Pag nakikita mo yon, medyo malaki pa yan. So 1/1000th of a millimeter, you cannot see, and they float. And they're there. They come from, of course, you ask, what is the particle size distribution of human breath? It turns out it goes from less than 1 micron to 100 plus to 1 micron. And for the longest time, the medical community was latching on to this 5 micron parang cut-off. Anything larger than 5 microns, you sort of say they will be droplets, they'll drop. Anything less than 5 microns, they'll float. Now, scientists were asking, saan ang galing yung 5 micron cut-off na yan? And it turns out, it came from a study back in the 1940s from a Harvard engineer named, what's his name? William Wells. In his study, he said from 0 to 100 microns, lulutang ho yan, lulutang. Greater than 1 microns, they will drop. From human breath, or kung may bomba man kayo, nung bygone or whatever, they'll drop. But anything less, and so they were wondering, how come, where did the 5 come from? It turns out that in the 1950s, a guy named Langmuir, who was the first director of the CDC in the US, came up with this, he read this study about miners and factory workers and discovered that our upper respiratory tract can trap particles that are 5 microns and larger. Those that are less than 5 microns, they penetrate deeper into the lungs. So they latched onto that, and actually Langmuir was concerned about bioweapons, chemical warfare. And they said, if you want to weaponize particles, this was during the Korean War, if you wanted to weaponize bioaerosols, they should be less than 5 microns, if you wanted to. So anyway, to make a long story short, nawala yung 100 microns, naging 5. And that has stayed on. Even the WHO latched on to this. And in fact, when this whole thing began, one of the first facts that was released by WHO was fact. Sabi nila, fact, COVID-19 is not airborne. And of course, that, that was a puzzle to us, atmospheric scientists, and engineers. We said, paano yun? Depende yun, di ba? It depends on whether you are actually emitting very large droplets or small droplets from your breath, about when you're sneezing or when you're coughing. Now, the reason why WHO was slow to accept this was because there was inertia. The scientists and engineers, they were working in their own little silos, and the doctors, they're also working in their own, and they were not talking. Well, they did attempt, but there was shouting. There was really talking down on each other. And I base this now, the next few thoughts, on Justin Morgenstern's presentation. Sabi niya, dalawa lang naman yung argument eh. Sabi nila, yung mga anti-aerosol, sabi nila, if it is airborne, then how come, then it should be very infective. Di ba? Dapat maraming magkakasakit. Eh, ang liit ng R0, yung transmissivity. Di ba? Maliit yung R0 eh. And actually, it's a fallacy. The mode of transmission, which is airborne transmission, is very different from infectivity or transmissibility. Kasi some pathogens require higher viral loads to cause infection. And therefore, they have very low R0. No matter the mode of transmission, whether it's airborne, aerosol, or droplet. The disease transmission may be low on average, but alam nyo, there are also super spreader events diba? That make COVID look like measles. Kasi yung measles, high R0 yan Pero yung tuberculosis, very low R0, 1 to 3 lang like COVID, kumbaga. What are these super spreader events? We know them. In February 2020, there was in a restaurant in Guangzhou, a family comes from Wuhan, and then they proceed to infect people in the restaurant. This was before Chinese New Year. But the most famous super spreader event was the choir practice in somewhere in Washington State, diba? We've heard of that. So anyway, that was the first objection. Now, if it is airborne, punto nila, hindi dapat airborne kasi dapat mataas yung infectivity. Pero yun nga, a high R0 or a low R0 has nothing to do with the mode of transmission. The second objection to airborne thesis was that kung airborne, then infections should be occurring over large distances. Local Di ba? Malapit lang, nandito lang yung, parang close contact lang This was from a lot of epidemiological studies. And again here, we have to distinguish between mode of transmission, airborne, and distance. If you have an infectious person, actually, even if it's airborne, it decreases exponentially. Why? Because it spreads out in space, 3D space. So in fact, we use what we call a Gaussian dispersion model. So that as you go farther, mas konti na lang yung viral load. For example, historically, tuberculosis was assumed to be transmitted via droplets and fomites because it occurred after close contact. And now we know TB is transmitted via aerosols. Diba? Ganun yung parang tinitingnan nga, para ba ito bang TB ba ito o hindi? In fact, infection via close contact does not always mean big droplet transmission. So anyway, let me just end by, saying that measles and TB are airborne. And therefore, long-range transmission is possible, especially with longer exposure. Pwede ring walang long-range transmission, basta yung exposure maiksi. Let me just add to all this, I think there's a difference between symptomatic and asymptomatic transmission. I think, I'm not a doctor, pero if you are symptomatic, there are larger droplets. I guess because of the liquid load Mas maraming liquid na generate yung lungs mo And therefore, these things coagulate and they become bigger, and therefore they will fall by gravity. Pero paano kung asymptomatic? Di ba? Kung asymptomatic, then therefore it could be airborne. And more worrisome. The second is humidity. Kung tuyo po yung hangin sa paligid, then the droplets evaporate. Di ba? They become droplet nuclei. And so they become airborne. Once they evaporate, they become lighter. And so they will move even farther. So humidity is important as well. So anyway, to go back to end, yung policy recommendations lang ay totoo pa rin yun. Mask, social distancing, washing of hands, and if airborne, if you think that COVID is airborne, then yes, ventilation, filtration, disinfection, distancing, lalo na, mask, at if I may add, silence, no speaking in crowded places. Don't talk too much. No talking, parang library. Yun lang po. Maraming salamat.
Thank you so much, Father Jett. Something that we not a lot of people knew po, no, but really very, very valuable insights from our atmospheric physicists. Thank you po, Father Jett, for that really insightful talk. And before we go on to our panel discussion, we will call on our last reactor po. She is really a veteran broadcast journalist, has been talking about a lot of the health topics po that we have, and she will be discussing how to communicate all of the information, the health risks to the public. Please welcome to the webinar, Niña Corpuz. Niña, welcome to the webinar. Will you be the one to control your slides?
Yes. Hi, Raymond, Dr. Raymond. Thank you for inviting me. Good afternoon po sa inyong lahat. I've been asked to talk about how to communicate COVID health issues more effectively, lalo na po ngayong may pandemya tayo. So hindi po ako doktor, hindi ako engineer or physicist. And I just like to say thank you so much for our speakers. No? Ang dami ko pong natutunan bilang hindi lang bilang isang broadcaster, kundi bilang isang ina at isang citizen, I would say a responsible and concerned citizen. So my presentation is for all of you, whether you're a frontliner, a doctor, or somebody who represents a group or institution, or even as an ordinary citizen like me. There is another quote unquote deadly virus po that may sometimes be more dangerous than COVID. Alam niyo po ba kung ano yun? Fake news. Okay. Just before this pandemic happened po, I attended a medical misinformation summit just before the pandemic sa Google headquarters in Singapore. And one of the speakers said, fake news kills. This was before COVID. He was talking about miracle cures and false claims that can make one person do something he believes might cure his illness, or not seek the right medical attention or intervention that can cause his or her life. So when COVID happened, mas dumami pa ang mga haka-haka at maling paniniwala na minsan po, mas mabilis pa ang pagkalat kaysa sa mismong pandemic. At ano kaya ito? Ito po ay ang tinatawag na infodemic. Kung hindi ka eksperto, mahirap talaga malaman kung ano ang dapat paniwalaan sa panahon ngayon. Pero pag narinig natin na sinabi ng isang politiko, kaibigan o kapitbahay na gumaling sila dahil sa sakit, dahil sa kanilang sakit, no? Dahil uminom sila ng linwa o ng ivermectin, kadalasan yung unang reaksyon natin would be talaga, gagawin ko nga rin yan o irerekomenda ko yan sa kamag-anak ko. Mas madali kasing paniwalaan po, di ba? Pag may taong nagsabi sa'yo at may kasama pang kwento, mas nakaka-relate tayo. So today, I'm just going to enumerate 4 tips that can help us communicate medical information and not misinformation. My first tip would be humanize the story. As I said earlier, it's easier to listen to people who have a story rather than understanding technical aspects of the disease. When I was a reporter, my editors would always remind us to put a face to these numbers or start with a case study from micro to macro. It's good to give examples that will catch attention. Sabi ko nga po, dapat may kwento. For example, sa webinar po last week, COVID in Children, which I attended, I was really listening to the teenager who got COVID and her mother about their experiences, thoughts, and what they're going through as a family. Then after that, the doctor gave her expert opinion, which made it easier for a parent like me to make a decision. So this brings me to another important issue worth mentioning. Listen to the experts. Quote the experts and scientific studies, not politicians or anyone else who is not an expert. Science po is not a turn off to millennials and Gen Z. Sayang hindi na ako kasama dito sa millennials or Gen Z. Pero kahit na po, puro TikTok sila, they always want correct and credible information. Do you agree with me, no, mga millennial and Gen Z? You are highly aware. You know about the fake news. But the problem is apathy. They know how to spot fake news, but they also just let it slide. Because of this, diba? Another tip or strategy is that we need to make our audience care. Always direct it back to your audience. How will it affect them? Not just in terms of, life and death, but also the day-to-day of our lives. Yes, I know that I can eat face-to-face with my bubble, but can I dine face-to-face with my friends? Should it be indoor, al fresco? What is acceptable? So kanina nakakatuwa, I saw a video of the UP students na nagbigay ng reenactment on how to dine in or out, or how to eat their baon. So it's nice to put a face like that so we can relate more. So this one is an article actually from the New York Times, How to Hug During a Pandemic, from scientists who study airborne viruses. Hugging is such a simple thing, but it is also important. I was told po marami sa mga audience natin ngayon ang frontliners, no? When I was getting my first jab of vaccine last month, I heard so many stories of side effects. And so I told the nurse all my fears. Takot na takot ako when I was about to get vaccinated. And she said, well, ma'am, meron talagang side effects sa iba. She then told me her horror story of all her side effects when she got vaccinated. As in lahat nangyari sa kanya. Nawalan pa siya ng sense of taste and smell, no? But then she got through it after 3 days. And here she was, back on the job doing what she does best. And yes, while she scared me a little bit more, it made me feel better to see that, hey, she's okay. So yes, all of you are our heroes, our frontliners, our doctors. But thank you also for taking time to talk to us and showing empathy and your humanity. Na tao rin kayo. Pareho tayo. All of us will get through it. And so my next tip would be learn the tools of the trade. Try to speak the language of your audience. As we all know, social media has become a powerful tool in our lives. It has displaced TV as a source of news for many people. Learning how to maximize this tool will definitely be an advantage, especially for the experts who want to catch the attention of the public. So I'm so glad to see the slides kanina from our doctors, no? And they really did their best to show us those infographics. Because visual storytelling is very important. Even the news agencies like ABS-CBN and Rappler have been using a lot of infographics, no? The DOH and the WHO have also been doing infographics and art cards. So for us, a good tip would be to change our template. Siguro minsan maganda rin na iba-ibahin ito para hindi isipin ng tao na yan din yung dati, basa ko na yan o nakita ko na yan. In ABS-CBN, they have NXT, which tells the story with subtitles within a minute. Sometimes they encourage interactivity with a swipe up to view tool, so the user can go to the main story, which is more complete. Also, in making videos, the first 5 seconds is very important, And this is based on a study. That's just how long people will pay attention if they like to continue watching or not. Hindi na uso ngayon yung beginning, middle, and end, where the story slowly builds up. No, you start with a bang. Make sure your first 5 seconds will get their attention right away. There are different ways of doing this, hooking your audience. You can start with your best video, or you can make it bitin or kakaiba. Recently, pinapanood ko yung Tony Talks, no? Which has millions of viewers, and her interviews usually start with bloopers, matatawa ka na agad, or very dramatic, or the juiciest part, which will make you want to see more. Mas challenging nga lang if your topic is COVID, so maybe you can start with the most important information. Sometimes, no, unfortunately, you have to use something that will get the attention, or something shocking, something new, something human or personal. And finally, educate your audience on how to spot fake news. Is there attribution where the information came from? Is there a clickable link that will bring you to the original story? Did the news come from a credible or recognizable website? As part of the tools of the trade, when you present an infographic, it would be best that there is a credible link that will lead you to your website or article where the infographics was based on. When you have infographics, minsan kailangan clickable yan, or kailangan meron po tayong attribution. Mahirap talaga to teach people attribution. No? Sa dulo ng mga libro, di ba, may appendix or bibliography, but who actually reads them? It's so hard to expect people to do research after they read something so compelling. We are all online. We are all responsible. We should stop blindlessly forwarding things na finorward ng kaibigan. Otherwise, you will contribute to the infodemic. It's really best to ask an expert or forward niyo po yan sa doctor friend nyo before forwarding it to a group, or research it yourself. We should be more cautious about websites. Maraming fake. May kunyari nga ABS-CBN or CNN with the logo at kamukhang-kamukha ng original website. So if the news is too shocking or too good to be true, or anything that promises a cure, think twice. Look at other articles from other credible news sites, at least 2 or 3 more. Minsan, sorry lang po, alam ko, you're celebrating your 60th episode. Minsan mas guilty po dyan yung mga seniors natin, sorry po. Nako, mga tito at tita ko, even my parents, minsan may pino-forward sa akin na hindi ka panipaniwala. Imagine po natuto po tayo mag-Facebook. We also need to be more discerning. Check your source. If there is no source, kung walang source po yan, just a story without any attribution, malamang fake po yan. It should not just be the media's responsibility, but everyone's responsibility to be able to teach people how to spot fake news. We all make mistakes, and we can all learn from these mistakes. Sama-sama po tayong lahat dito, tulungan, bayanihan. Let me just say again that social media has displaced TV. Social media, that's us. We are all part of it. While media has a loud voice, our many little voices can sometimes overpower it, and it can go out of control. Let's fight COVID together by helping each other be informed and educated. So ito po ang aking last slide. Let me leave you with Alden Richards. Sabi niya, labanan ang kontrabida. So these art cards po are from the DOH. Thank you so much.
Okay, thank you very much. That was Niña Corpuz, very well-known personality in broadcast journalism, and thank you for that wonderful presentation. Okay, we are going into our panel discussion. We're going to ask everyone to open their cameras, but before we do that, we have a public service announcement from TVUP. TVUP, over to you.
Mahalaga ang lakad na ito. Tigasin ka ba?
Siyempre!
Mahal ba si Commander?
Mahal na mahal! Pare, mahal mo ba ako?
Oo naman, ano?
Mahal mo ba ang tropa?
Oo ba?
Tara na, magpapakuna na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you very much, TVUP, for that public service announcement called Tigasin. Tigasin ba tawag na? Tropang
Yes.
Tigasin. Okay.
Yes, okay.
Okay ba yun, Raymond? Mahal mo ba ako? Okay. Let's have everyone's cameras open. Vice President Min,
Any Pernia?
yeah.
On
Nenny.
here. Okay.
Ito, nakita ko na. VP Nenny, we have Father Jett, we have Dr. Nina Berba, we have Niña Corpuz, and of course we have Dr. Happy. Okay, so I think we all have our cameras open, and I thought I would ask you to actually field some questions to each other. I like what Father Jett said na, you know, the scientists were working in their own, you know, their own silo, and the medical folks were working in their own silo. And of course it was, you know, in the heady days, in the early days of the pandemic, we were all scrambling. I think we were all scrambling. But we have opportunities now to discuss, to find a better path forward. And sabi nga natin, lahat ng talino, kailangan natin, no? Hindi lang mga doktor, hindi lang mga health workers, pero lahat ng mga, all the different disciplines have something to contribute to this discussion. So, does anyone want to ask a question to anyone first?
May question ako, pwede?
Go ahead, Nenny, go ahead.
Yeah. Doc Nina, maganda yung yung presentation mo, yung paglalagay ng mga fans para for airing out the wards, and even yung sa atrium ng PGH. Question ko lang, how was the coordination between you, the medical doctors of PGH, with our engineers? Kaya ba nagawa yung ganong klaseng ventilation kasi close na ang interaction ninyo?
Well, nung we were selected to be a COVID referral center, we only really had like 1 week to prepare. So talagang we scrambled for really very close coordination. Fortunately, you know, the stars fell into place. Nag-cooperate lahat ng tao. Pati yung mga gamit na kailangan namin nakadating. So by the time we needed to open the COVID wards, we were ready. So yes, ma'am, talagang nag-cooperate po lahat.
Yeah.
That was very, very, very important.
Magandang bayanihan nga yung mga nangyari dun sa simula na yun, di ba?
Yeah, Charlotte, our Dean from the UP College of Medicine is actually going to give her closing remarks, but she's in the panel. And Charlotte, please ask the question.
Well, I'm not going to ask the question, but I'm going to clarify how that happened. Now, 1 week lang, and we were able to already get the air ventilation sorted out for the pavilion of PGH, no? Maswerte lang po because at that time, the Medical Sciences building of UP College of Medicine is being built. And of course, we had the MCI already building our building. So we got them to support PGH. So they sent their engineers, look at the pavilion, and they were the ones who actually designed the airflow. Alam mo naman po nyo, yung PGH pavilion was actually built in the early 1907 po yan binild, and it was open to the public in 1910. And magugulat kayo, these are all pavilions na hindi air-conditioned. And there's a purpose for that because at that time, because of our tropical climate, the engineers at that time, the hospital experts, wanted a hospital that will be safe for patients so that infections will be controlled. And I think that design is still something that worked for PGH because all we had to do was to install the big air fans and also to direct the air going outside to the windows and into the in-pocket gardens in between pavilions for air circulation or contaminated air to go out. So yun po yung nangyari dyan.
Yeah, I think the well, of course, Nenny's question is about the coordination, or how do you get that all organized? But just adding on to what Dean Charlotte just mentioned, I think if you look at how hospitals were designed in the olden days, and I'm currently in the United States, and I visited the City of Hope in California, which used to be a tuberculosis hospital, and was designed, it actually looked like PGH, pero one floor lang. And it was converted into a cancer institute later on. But you could see that, and which also turned out okay, because you can open windows in every room. Unlike modern, more recent hospitals where sometimes you can't open a window. No, so some of the hospitals are designed for centralized air conditioning. You cannot open a window. There probably are no fresh air ducts or whatever that is that we use not to have airflow. But I think this is pointing to really the need for a conversation between not just the doctors, but architects, engineers, physicists, and other experts as we try to solve this problem. And just seeing recently that Singapore is already talking about not a pandemic, but COVID-19 being endemic. So I think when we're now thinking about our hospitals, what they're supposed to look like, how we're going to design them, we should really be thinking about not just what it looks like, but how we can do better at ventilation. Raymond, you had a question. Go ahead.
Actually, we have, maybe I could piggyback on the questions that we have since we will be coming very, very near to the top of the hour. Our most upvoted question po, we'll just select that one. And it reads from one of our regulars, Maria Cecilia Pulido po. Good afternoon. Para po sa mga low-income families, ano po ang pinaka-budget-friendly na paraan para maayos ang tahanan in a way that it could lessen the chances na magkahawaan ang mga tao po, which is problematic kung maraming nakatira sa isang maliit na tahanan. Let's direct it to our main discussant po, Dr. Happy. Dr. Happy?
Hello. As mentioned po kanina, the best thing po talaga is to open as many windows and doors as possible, especially if nagkukupul po tayo lahat in small rooms and we don't want to spend any more for electricity for electric fans. Otherwise, and of course, kung pwede, even use face masks in your homes. If there is already a high risk of transmission, kung may duda na kayo na isa sa mga kasama niyo ay may sakit, definitely isolation po, health protocols na po tayo.
Okay, I think, yeah. Thank you very much, Doc Happy. Raymond, I think we have someone from the audience who's going to ask a question. And then later we'll go back to the fun poll. But Raymond, you want to introduce our member of the audience who's going to ask a question?
We have here joining us po really the one who inspired us to start this webinar topic, Dr. Ray Santos po. From UPCM class of 1981. Dr. Ray, if you could open your videos po. Okay, so while we're waiting for, there we go. Okay, Dr. Ray, magandang umaga po or magandang hapon kung nasan man po kayo, sir. Please feel free to unmute yourself and ask question to anyone on the panel.
Okay. Thank you very much for taking in the topic that I suggested. I just want to ask if what is the best way of monitoring whether there's actually a very good air exchange going on? Would monitoring CO2 levels in a enclosed space be an indirect measure that you have had adequate air circulation? Because sometimes I think it was mentioned that you need about 6 to 15 air exchanges per hour, but that's too highly technical, and we have to go to our filters to monitor if it's actually being achieved. And if that is the case, it's a simple monitoring thing that we could do, just like we monitor our O2 sat. If you could measure CO2 levels in an enclosed environment so that you could tell whether you have a rather healthy enclosed space and what is the acceptable limit for the CO2 levels. Thank you.
Okay, I think we want to direct that to Father Jett. Father Jett, please.
Okay, thank you. Well, yes, we're still studying this, but CO2 can be a proxy indicator, actually. Ambient CO2 is about 400 ppm. And if you go to a crowded place, that can shoot up to several thousand. I think human breath is about 40,000 ppm. Pero when you're in an enclosure, I think there are some standards that are being thought about now. Like if the CO2 goes to about 800 to 1,000 ppm, then chances are you're already breathing a portion of someone else's air. So they would probably say 800 to 1,000 is a good index of crowding, of no social distancing, of a dense room. So, but actually, I built a little CO2 monitor myself. I'm trying to do this now here in the Jesuit residence, just to monitor ambient CO2. And I'm also looking at particulate matter, because I mean, particulate matter is all over, right? So yun lang ang concern ko, halimbawa lang when you open windows is that, of course, you're presuming that the ambient air is clean, no? If you're in PGH and you're right next to Taft Avenue, I mean, medyo iba rin yun. Pero at least walang bio-aerosol, no? I mean, walang COVID. Pero iba-ibang klaseng mga pollutant rin ang nandyan sa hangin, eh. So anyway, yes, CO2 can be a proxy indicator, measuring CO2. And if you could add particulate matter too. There are some cheap monitors out there already that measure PM1, PM2.5, and up to PM10 optically, no, real time. So baka yun, pwedeng ilagay lang. Kaya lang, kung nasa hospital ka, hindi ko lang kung saan mo ilalagay. Kung wala kayong meter, ako inisip ko, mag-sigarilyo yung isa. Pag naamoy mo yung sigarilyo, ibig sabihin hindi nagsisirculate. Di ba? That's an aerosol, eh. So we know that, you know, you'll have to evacuate, you know, that air, that dirty air. So a good perhaps, you know, is amoy itself. No? It's a tracer. No? Cigarette smoke is a tracer. Although of course I would not suggest that in a hospital. But a gas like CO2 would be good, I think, as a proxy. Thank you.
Thank you very much, Father Jett. I think I was just looking online, and I think there are many CO2 monitors that can be used. I mean, I think as people start thinking about workplace and public transportation, for example, or even opening of school or partial work of teachers, if we're saying that it's a good proxy, I think there are, I mean, again, when I was working on tobacco control, we were measuring PM 2.5, and we don't want anyone to smoke, Father Jett, because of this webinar. So, so we will look for monitors that don't, you know, I know what you're saying. I understand what you're saying, but I was just looking online. There are, in fact, a number of commercially available monitors, and I think, you know, in a war, anything you can use, any weapon is useful, no? So if we're saying that, so my question is, does it help to have more plants in your house or around you? Does that help?
Plants? You mean plants?
Yeah, plants. Halaman, plants.
No. Yeah. Well, they absorb only a minimal amount of CO2. Really, you'd need a forest. You need a tree actually to absorb the CO2. But it's not. Again, here it's the circulation that's important, diba? Doc Happy mentioned sometimes these barriers can impede the flow. So actually, any tracer, pabango, diba?
Yeah, anything you can smell. Anything that you can
Basta may
smell.
smell. Oh, pag naamoy mo, then it's not, diba? It's coming from. Think
Yeah,
of a mouth, a person as a bomba, a source of aerosol.
Yeah. Raymond, did we want to go to the poll questions before we take in a few more questions? Because we're past the top of the hour. I know everyone, so many questions in the chat box, but let's answer the questions, Raymond. Go ahead.
Okay, thank you so much. But before we proceed, I'd just like to mention po that the earlier public service announcement is part of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by none other than our lovely VP for Public Affairs, si Ma'am Neni Pernia. It's part of the joint DOH, DOS, PCHRD AHEAD HPR project. And we hope that something that will be helpful as we try to make it and disseminate that information to the general public. On to our fun polls, the two questions that we have. Kayo po ay napaplano ng inyong family Sunday lunch sa isang public place. Saan po ba ang tingin ninyo na safest na mag-set up kapag alas 12 ng tanghali? Is it an open air or garden setting or al fresco setting? 92% of our respondents yun po ang pinili. 6% chose a restaurant with open windows. And then 2% chose air-conditioned restaurant. Dr. Happy, ano po ang kasagutan sa ating unang katanungan?
Well, we prefer the open air. That is correct. But of course, may caveat dyan, baka mainit ka lang. But safest is open air.
Open air. Thank you, Dr. Happy. And for our second question, the following principles that should guide decisions around retrofitting spaces such as classrooms, houses, offices, etc. Lahat po ito except pwera lang po. So top answer, 37% chose kung meron pong mga bintana in a non-air conditioned room, open them. Followed by if there are no other options, put ceiling fans. And then another, the next set of respondents chose 25% po sila. If affordable, put in distributed air filtration system, and then finally 11% chose if room is enclosed, put in fresh air duct. So alin po dito ang dapat hindi gawin, Dr. Happy?
Yung last po, yung ceiling fans. Kasi
okay.
pag kulob po, wala pong magagawa ang ceiling fans except just spread the virus around.
Okay, thank you so much, Dr. Happy. And then we'll move on to our really set of questions. And this may be an option po, very controversial. I mean, in terms of the issues that we are talking about po with regards to the face shields. What is, from an engineering standpoint and maybe from a physicist standpoint po, no, we'll try, and then from an infectious disease standpoint, we'll try to get each of your answers to this question. What's your expert opinion with regards to the acrylic barriers po na makikita po natin sa mga bangko, makikita po natin sa iba't ibang mga lugar? Dr. Happy muna po.
For the barriers that I find in the banks, they are appropriate because frontliners po sa literally frontline kasi they interface with customers where pwedeng direct droplet ang pupunta sa mga mukha nila eh. So appropriate po yun. There are other questions here about yung mga barriers in between, let's say, sa mga workplaces. It might be, I would tend to find those less useful and would actually impede airflow. So may certain purposes lang po. Like if meron po kayong kaharap talaga na tao, use those.
Okay, thank you so much. Ma'am Nina Berba.
Oh, sorry.
And any comments to that to that question po, ma'am?
And the acrylic barriers, yeah, tama po yun when the interaction poses strong enough risks to one of the persons dun sa interaction na yun. Mas maganda may acrylic barriers. Pero you choose the type of barriers that you can clean. Kasi minsan the barriers we choose are yung mga plastic, naluluma, pumapangit, nadudumihan, tapos mahirap linisin. So they in a way become fomites also, diba? They can keep the viruses or even other bacterial agents there. So choose the material for the barriers that you will use.
So Ma'am Nina, I mean there's a follow-up question with regards to that. Kasi our public transportation po, essentially they use po yung mga plastic, ma'am. Is there what would you recommend in order to improve the protection po in public transportation vehicles po?
Yung dun sa parang yung kunyari sa open jeepneys, parang walang use yung barriers po dun eh. Kasi, diba, you're actually impeding the movement of air within that vehicle. Parang gusto mo nagfo-flow lang yung air into and out of jeepneys and buses na may open windows. Yeah. So ako, I'm not for putting yung mga plastics doon.
Okay. Raymond, we are past the top of the hour, but we were going to ask Niña Corpuz to ask any of our panelists a question as a parent. So many parents who are watching, our health frontline workers are parents. So Niña, over to you for a question to any of our panelists from the point of view of a parent.
And for example, I'm a frontliner. No, that's hard because I've heard of stories na mga doktor or nurse or frontliner na nahawa yung anak nila. So, di ba, you feel so guilty. So maybe we should just we can refresh our our frontliners once again. Ano po yung mga kailangan gawin pag uwi nila sa bahay talaga? At kailangan ba separate sila kumain kasama ng asawa nila o ng anak nila? Paano kung may baby? Ang dami mong pandemic baby ngayon. How do we protect the babies or the vulnerable population or the senior citizen, for example, yung lolo at lola from them? Kasi dati naalala ko po nung umpisa, grabe, talagang pagpasok mo ng bahay, aalisin mo lahat eh. Ngayon medyo hindi na po tayo ganun ka-careful or ka-vigilant. Should we continue to be as vigilant?
Okay, the home setting. I think we're gonna ask Nina Berba to answer that. Go ahead, Nina.
Sige. So ako po, I've been a frontliner for a while already. Tapos, fortunately, hindi pa ako nagka-COVID. I think we need to really keep the precautions in place very strictly kung frontliner seeing COVID patients. Kasi di ka talaga pwede magkamali at ayaw mo talaga magka-active COVID, especially when you're going home every day. So when we get home, or what yung mga infectious disease people would do is really to, as soon as you enter the home, like what you described, Niña, sobrang, if it means being obsessive compulsive, just do that. Clean yourself, remove all the potential contaminated things that you brought from the hospital, from the workplace. Don't bring them into your home. I have like a cleaning material. I dump all my stuff there. Hindi na nga ako nag-watch or nag-bracelet or things like that kasi they might become contaminated. And then you just really clean yourself and be continuously vigilant and mindful. I don't think I need to isolate myself from the children when we eat dinner. Kasi parang dapat the precaution should happen while you're in the workplace eh. Yun. Dapat yun. Hindi mo makuha yung infection. Tapos pagkalabas mo ng ospital, malinis ka na. Pagdating mo sa bahay, may second layer of precautions. And then you enjoy the moment with your family. That's what I do po.
Okay, thank you very much. That's Dr. Niña Berba of the Philippine General Hospital. Okay, so we are going to have parting words from everyone, just a few words for our audience before we leave. And while we're doing that, we're going to put up our evaluation poll. So we are going to start with Niña Corpuz. Niña, please go ahead. Your final message.
Yeah, thank you very much for having me in today's webinar. Really honored to be alongside the people that hashtag Lodi, ating mga Dean and former President. Salamat po for having me. It was a great pleasure listening to all of you. And sa lahat po na nanonood ngayon, ang swerte niyo po dahil nakinig tayo sa kanila. At sana pa ako nagsulat rin ako ng notes. And I don't know, siguro as a communicator, we always say, beat COVID, stop COVID. I don't know, can we ever really beat it? Kasi when we say stop COVID, beat COVID, after a while, people become not as careful anymore. So people, kunyari, kahit nabakunahan ka na, o pinipost pa sa social media, kumain na kami, lumabas na ako kasi nabakunahan na ako. I don't really agree with that so much. No? I mean, good, pag may bakuna ka, all the better. I'm all for it, no? Pero siguro the attitude that we want to impart siguro as communicators to the public is wag na muna natin isipin beat COVID, although yan talaga yung ideal situation. But you know, how we can be more vigilant, how we can prevent COVID, I think that is more important. You know, that's most important right now, preventing COVID. And so I hope that's the message that I really want to, you know, tell everyone. And I hope that after listening to all the panelists, ma-revive na naman po yung ating sense of, you know, vigilance. Kasi medyo nawala na po kasi magto 2 years na eh. So dapat po wag mawawala yan. And thank you for having these webinars. Very helpful. It really reminds us to, you know, be vigilant. Wag po tayong titigil sa pakikinig at gagawin po natin ng lahat to prevent COVID. Kasi madaling magsalita, pero pag nangyari po sa pamilya nyo yan, ibang usapan na po yan, ayaw po nating mangyari yan. So maraming salamat po for sharing all your thoughts and your expertise. Thank you.
Thank you for joining us, Niña. Let's go to Father Jett. Father Jett, go ahead.
Hi. Yes. Well, first, I think this issue of airborne or not has opened a lot of doors for all of us. It's not just for COVID, but even for influenza and other things. No? In the past, we've sort of taken it for granted. Diba? You know, school children will spread the flu or measles, you know, in classrooms, and we never really gave a thought about ventilation or, you know, other things. So I think this has ripple effects beyond COVID. I think after this, or during and after this pandemic, we will be more wise about our spaces. The second point I wish to it is hope, a sign of hope. You know, I work on climate change, and it's really not easy to decarbonize the economy. You know, it's going to take a lot of effort. And yet, when I look at what we have done in this pandemic, you know, we thought a vaccine was not possible within a year. I mean, who would have thought? I mean, we've been working on AIDS for so long, etc. And when science comes together, when people come together, I mean, something good happens, diba? When people break those silos and really, you know, listen, ayun, may nangyayari. I think it's a good sign, really, for all of us. Sign of hope. Now, the pandemic will probably last, for many years. I mean, 100 years ago, the flu pandemic lasted for more than 2 years, and there were still some effects, diba? Pero, yun na nga, we will. No, this will be beaten, but I think this has made us all the wiser now, and I hope we also realize. We hope that it has made us more compassionate, because we've realized our vulnerability. Diba? Some people told me they've become more spiritual now. I guess, you know, there are no atheists in foxholes. If you think that your life is just a few years, then it makes you ask these questions that really matter. So yun lang. Thank you for inviting me to this forum. And hindi pa tapos. So I look forward to learning more and to sharing more of what we've learned with others. Salamat po.
Thank you very much, Father Jett. We now go to Dr. Nina Berba. Nina.
I want to leave you all with an assignment. Gusto ko kayo bigyan ng homework. So after leaving this Zoom meeting, look around you where you are, where you're working, or if you're at home, look at your home situation and try to make some changes and improvements, particularly in ventilation, kasi it's going to be very, very important. If we really want to surpass and overcome this pandemic, we really need to make some improvements in the ventilations, things that will stay on even beyond the pandemic. So assignment po yun for all of us. Sabi dito, there's 1,200 here in our meeting today. So that will be a big forceful change if each one of us will look around us to improve whatever we can.
Thank you very much for that, Nina. Let's go to Professor Happy. Dr. Happy.
Hello, good afternoon again. Nina, umabot actually tayo ng 1,400 kanina eh. So there really is a big change na possible. I can siguro only say na lang po talaga that to everybody who listened in, we have to, parang it's a bit of a cliche, pero yun nga, parang an ounce of prevention is worth a pound of cure. We all know na, we've heard of those stories where parang a little bit too late and all that. We can do something. Small things that can be of big help to keep our family members safe and healthy. And as long as we just really parang look into our environment, see what we can do, and especially for our, let's say, building administrators, heads of units, we bear the responsibility to keep our constituents safe. For example, ako from the university po, our students, our staff, how do we make a cleaner and safer environment? We have a role, we have a responsibility for that. And we should really look at how we can say maybe adjust our environments, our offices. What do we really need? So thank you very much, Bob.
Okay, thank you very much. And last but not least, we have our Vice President for the University of the Philippines, Dr. Niña Pernia. Niña, please go ahead.
Okay, thank you. Marami na tayong narinig, no, na napaka-useful, no. So hindi ko nga alam kung anong sasabihin ko except that in addition to the homework that Doc Nina and Prof Happy have given, well, more Doc Nina has given us, no. I think one thing that I do want to add is that we should all realize that the response, the answer to the situation where we are in now does not lie in one particular field, but rather it is the participation of all disciplines, no? The idea of a multidisciplinary interprofessional collaboration is what is needed. So siguro yun nga, no, na parang ang sagot ay wala sa iisang profesyon, wala sa iisang disiplina, pero lahat tayo ay mag-aambag-ambag, magtutulong-tulungan para sa totoo, we will get over this. Yun lamang. Maraming salamat.
Thank you very much. That's our Vice President for Public Affairs, Dr. Niña Pernia. Okay, to give our brief synthesis of our webinar for today, we have the Dean of the UP College of Medicine, Dr. Charlotte Chiong. And while we're doing that, we are putting up our evaluation questions. So do you want to read that first, Raymond?
Okay, so we have 5 questions, really it's a Likert scale. A lot of our attendees have already answered. I'll read it off. Panelists demonstrated thorough knowledge of the topic. Panelists were well prepared and organized. Spoke clearly and audibly, used appropriate language with technical medical jargons adequately explained, and finally contributed to new perspectives and knowledge on managing various key COVID-19 health issues. You will also see po on the chat box a lot of our attendees really appreciated. Marami po sa kanila ang maraming natutunan dito po sa webinar na ito. And really that's something that we strive for, but really it's a testament po to the contributions of each and every one of our esteemed panel po. And really we are very, very thankful to each and every one of you.
Okay, over to Dean Charlotte Chiong of the UP College of Medicine. Go ahead, Charlotte.
Well, again, first, thank you to Dr. Ray Santos for suggesting this very good topic on airborne versus aerosol, although we know that perhaps there could be a better title. The mode of transmission is really the most significant aspect that needs to be understood by everyone. At paano ba talaga nagkakahawahan ngayong panahon ng pandemya, I think is still a question that has to be made significant by learning more about this topic. So we heard the perspective of our engineer, Professor Happy Denoga, and of course, Father Jett Villarin, our physicist, and other experts in the field like Dr. Niña Berba, and even somebody from the broadcast journalism field, Niña Corpuz. Let's start with VP Neni Pernia, no? And she said that 60 daw is a very significant number, and this is webinar 60, and per our Chinese tradition, nakailang cycles na tayo, but still we are learning a lot more about COVID and how we can still help each other go through and prevent COVID spread, no? And I that the webinar contributes in a way and therefore interprofessional approach is very important, and I think has been the topic of so many discussions that we had in the past. Well, we learned about infection control from the engineer's perspective, and that's from Professor Happy Denoga, and he talked about actually ventilation, filtration, and even air distribution. He talked about engineering innovations like MERV 13, which is actually something that we're now going to use in the new medical sciences building at the UP College of Medicine. And he talked about the use of HEPA filters. We also note that he said that there are actually some ways of being able to actually minimize the cost depending on your budget. You can actually just open the windows, install fans, install exhaust fans, and if you have some money, you can actually buy the HEPA filters or even the UV equipment to help you in terms of infection control. I really like the way Father Jett talked to us about some historical vignettes about paano nga ba yung 5 microns and how this actually developed these protocols. He talked about 5 microns as being just the size by which particles actually get trapped in our upper airways, but lower than that, it can go to our lower airways. So it's a good review of how infections can actually spread. And he likened the COVID to basically like a TB, where the R naught is not very high, but it can be transmitted by droplets, fomites, and also by airborne transmission. And then later on, he talked about perhaps a proxy way of trying to see whether air ventilation is okay, and that's the use of CO2 monitors. And he talked about 800 parts per million to 1,000 as perhaps a good level by which, and it's about 400 for actually good air control. Pero naisip ko, 800 parts per million is if you use that per my reading, actually you can still inhale about 1% of the air exhaled by others. So siguro we have to be a little bit more strict, but it's really very difficult if we should be buying all these CO2 monitors already. Thank you, Dr. Nina, for showing all the really nice graphics on how we were able again to ensure infection control in PGH, how we're able to actually help each other in terms of being able to get the PPE levels formed for our healthcare workers, because from the experience in PGH, we've been able to actually really control infections among our healthcare workers. And that's really mainly due to all the studies and all the work that's being done by the HICU, headed by Dr. Niña Berba. And Right now, again, binigyan pa niya tayo ng assignment. So ngayon, may assignment pa ho tayo from Dr. Nina that all of us, 1,200 of us, will have to do after this webinar. Thank you, Niña Corpuz, for your inputs from a perspective of a mother, a mom, and somebody from the public who actually told us about the importance of not spreading fake news, because really the infodemic and fake news is the one that's really spreading fear among our population. No? I think that we're doing well, but ang pinaka-importante is that we're here as together, trying to share information to the audience and trying to educate the public regarding how to prevent COVID. And as you can see here, based on our audience participation as well as the audience that keep watching these webinars, the Stop COVID webinar, mukhang meron na ho tayong following, and we'd like you to spread the news regarding the TVUP webinar that we have every Friday, because really it's a way for us to get together and help each other. But I would like to close this by saying na tama po, let's follow the advice of Father Jett. Let's all be compassionate, let's all be considerate. Let us not forget that in the midst of this pandemic, we have blessings that we can be thankful for, and we have our faith in and hope is very important, and we have to show our love for each other, our concern for each other, because that's really the only way we can survive this. We cannot do this alone. We have to work together, and we have to love each other and take care of each other. Maraming salamat.
Thank you very much. That's Dean Charlotte Chiong of the UP College of Medicine. Okay, next week. Naku, do not miss it next week. We have a virtual international conference on the Delta variant. So you don't want to miss this. We are going to try to get, we already have 2 speakers who are international. We will try to get a 3rd one. But I think that's the hot topic of the day, is the Delta variant and what every frontliner needs to know about the Delta variant. So please join us next week at the same time. And I think it's going to be a very exciting webinar next week. Over to you, Raymond.
Thank you, Dr. Susie, and thank you for that excellent synthesis and closing remarks, Dean Chiong. For those who would want to register for our webinar next week, we are putting it on the chat. It's bit.ly/stopcoviddeaths webinar 61. It will be our 61st episode next week. As mentioned by Dr. Susie, we will have guests internationally to talk about the Delta variant, which has become the dominant variant in at least 30 countries around the world. Hopefully, that's something that we will be able to avoid. And we hope that each and everyone, especially all our healthcare frontliners, will be able to join us next week, Friday, from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
Keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears, but right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others laugh before my tears, but right behind the mask, I look into myself and ask, Do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my head's died. The others faint before my fears, the others laugh before my tears, but right behind the mask I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others faint before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold